Yeah, hip labral tears, boy, a lot of people have them and they have no idea that they have them. And I would really encourage folks to watch some of our YouTube videos, especially the one that I did with the young athlete, female athlete, because she would externally rotate her hip, kind of like that, and then she would get a clicking, grinding, popping sound in the hip. If you have hip pain and you got clicking, grinding, popping sounds when you move your hip, I'm just telling you, you probably got a hip labral tear. At minimum, you have hip instability. And also the best treatment for that is prolotherapy. And it's not just me saying it. We did publish a study in the Open Rehabilitation Journal on it. Just to give you a synopsis of that paper, basically 2 out of 3 of those patients had already seen an orthopedic surgeon. They, of course, wanted to do an operation on them. I personally am not a big fan of the operations. I don't think you should take meniscus tissue out or labral tissue out, because by definition, if you have a hip labral tear, you got instability. So is taking out tissue that the body needs for stability, is that going to make you more stable or less stable? It's going to make you less stable, so it's not a good long-term option. Well, then folks will say, well, what about if they tack, they use titanium staples and then they staple it? Well, the meniscus and the labrum is a very pliable tissue. So do you think the labrum was meant to just be tacked on there? Imagine all the motion that you have in your hip or your meniscus. Those kind of tissues are called fibrocartilage. They're a cross between regular cartilage, which is very hard, and ligaments, which are somewhat pliable. So in other words, the labrum and the meniscus, not only do they provide stability, but they have to be able to move. And the problem is that if you staple the stuff down, then it's not moving. So in my opinion, all that's going to happen is long-term, you're going to end up having worse problems because you're going to get tears, and plus you have a metal object in the hip. And if you're an active person, it's not going to be good. I mean, to me, it's going to cause aggressive arthritis in the future. So I think a much better option is keep your own tissue, stimulate the repair of the labrum or the meniscus with prolotherapy. Sometimes we use platelet-rich plasma because it is a tear. The tear has to glue back together. So sometimes you got to use a thicker solution than the normal proliferant. But in the study we did, again, 19 patients, basically all the patients for the most part got down to a pain level of a 1. With exercise, on a scale of 0 to 10, they were between 7 and 8. So I mean, they were extremely disabled. With prolotherapy, we cured 54% of their symptoms. Exercise, got them back to exercise, full exercise, running. Often when you have a labral surgery, they'll tell you, your running days are over. Well, I'm telling you, your running days are here. Just get comprehensive prolotherapy. If you have a labral tear, you have a hip instability issue, it works very, very well. And now we have a paper to prove it.